Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and I'm going to walk you through a PRP treatment for hair restoration. So this is platelet-rich plasma. We collect this from your own blood and then we spin it and get rid of the red blood cells, are left with the platelet-rich plasma and re-inject that into the scalp, and it helps to nourish the hair follicles. It helps with signaling of the cells and for the hairs to start growing back again. So this works great for men and women who are starting to notice hair loss, whether it's a genetic pattern hair loss, a autoimmune type of hair loss such as alopecia areata, or even just telogen effluvium where you're losing hair kind of diffusely over the entire scalp. So it does tend to work for all types of hair loss situation. Initially, what we do, as you can see here, is that we draw some blood, and this is just a quick needle puncture. We use a butterfly needle, so it's very small. Once the blood is collected, then we put it into a centrifuge, and the centrifuge will spin the blood for about 10 minutes, and here is the collected blood, or you can see the serum and the red blood cells underneath. I like to collect as much of the PRP as possible from the junction point, and then here we are injecting the PRP into the scalp. It's just tiny little needle punctures using a 30 gauge needle, so it's a little painful but not terrible. We also like to use cold air just to give you added comfort. And again, this PRP is going to help stimulate the hairs to start growing again. Some other things I recommend using are a laser helmet, also using proper vitamins to give you correct nutrition, making sure there's no other underlying factor that's causing your hair loss. I also recommend using minoxidil topically. And this is the before photo on the patient, and here she is after. Thank you so much for watching. I hope that was informational for you. Do continue to watch our videos and do share, like, and comment on our posts. Thank you.